Dr. Thornley. I'm a neurologist. I subspecialize in epilepsy, and today I'm going to talk about medical marijuana and its effects on ADHD. So there's been a lot of hoopla in the media regarding effects of medical marijuana on pediatric patients, including ADHD, autism, epilepsy. So it's already been fairly well established that in epilepsy, it has a role. So there was a recent big clinical trial which was just published in January, showing the medical value of cannabidiol on 171 patients who underwent the study, and that there was about a 43% reduction of seizures. So that was probably one of the biggest clinical trial with the pediatric population. But now there's also been speculation on whether it can be used in autism, ADHD. So the purpose of this video is to review the literature and to see what the scientific evidence is for the use of medical marijuana in the pediatric patient with ADHD. So ADHD, which is attention deficit hyperactivity disorder, is a neuropsychiatric disorder. It can affect pediatric patients as well as young adults, where the most common symptoms are inattention, so they're easily distractible. An example of this is a preschooler who can't stay still in their seat and their attention wanders. The second would be hyperactivity, meaning they're very restless, constantly moving around, can't stay in their seat. And there's also impulsivity, meaning there's lack of delayed gratification. If they want something, they need it now. So these are some of the cardinal features of ADHD. So it's most commonly seen in the young pediatric population, but is also manifest in adults. And so I was reviewing the literature, and I was actually surprised at the paucity of literature documenting the scientific benefits in children. There have been a lot of studies in young adults, but I couldn't really find any studies on children. So of those that I could find, there was one study by Cooper in 2017, and they studied 30 patients. 15 were on placebo, 15 were on Sativex. Sativex is a medicine that they use in Europe for spasms and multiple sclerosis, but it has cannabidiol and THC. Cannabidiol is the non-psychoactive portion of the cannabis sativa plant, and then THC, or tetrahydrocannabinol, is also has medical value, and at low doses there's no psychoactive properties. So going back to the study, they found that statistically there was no significance. However, the scores in those with Sativex were found to have a better overall outcome, meaning they had less inattention, there's less hyperactivity, and less emotional lability. So even though it wasn't significant, the scores were actually higher. And if, let's say, it was 1,000 or 2,000, who knows what the scores would be? It would probably be even better. But there was some value to that study, and bigger studies are necessary. And then there was another study by Kelly in 2017, which showed that ADHD with the use of cannabis in young patients, they found that, and these are young adults, not children. It was very difficult to find any articles on the pediatric patient with ADHD and medical marijuana. But in ADHD plus the use of medical cannabis, they found that there was improvement in inhibition performance, and also there was less cognitive interference. So what is less cognitive interference? So that's the way your emotions or personality can override your decision-making skills. So for example, somebody who's very upset, they cannot make sound decisions. So that aspect was improved in young adults using cannabis with a history of ADHD. And also there was less inhibition performance, meaning distractions did not take away the attention towards the task. So that was also improved. However, these studies were in patients who had ADHD at a young age, and then they had a history of using cannabis, not for medical purposes, but it was just a part of their lifestyle. And then they studied these patients. So it's not clear to me how much medical marijuana was used in these patients. I'm sorry, it wasn't medical marijuana, it was cannabis, and it wasn't used for medical purposes. But regardless, the people who studied these young adults with ADHD were actually surprised in the improvement in these factors. In addition, it was also found that the right somatosensory, so this is left, this is right. Somatosensory pertains to the parietal region. Parietal region is the area of the brain that subserves sensation, including receiving all the input and processing information. So it's a reception area. So the right somatosensory area was also improved in the connectivity. So the connections in the brain were found to be improved, and this was thought due to be an adaptive feature. The article cited maladaptive, but who is to judge that? But it was found that the connections here became stronger in the presence of cannabis. Now, going back to the purpose of this video, I wanted to review this subject because I'm always curious about things, and I was seeing all these reports. There was no basis, and I couldn't find a reference whenever people alluded to the fact that medical cannabis can be used in ADHD. So there is clinical information that it's used in young adults, but not so much pediatric patients. So that's still up in the air regarding benefits. You can probably extrapolate that there will be benefit in children, but the developing brain is completely different from a matured brain. So the mechanism or the physiology is going to be completely different. And whenever you talk about medications in pediatric patients, you always worry about the effect on development. So I researched the literature, and what I could find was that in the fetus, in fetal exposure to marijuana, so the mother has been using it for recreational purposes, it was found that fetuses that were exposed in utero had increased hyperactivity, they were had more impulsivity, and at a later age they had more delinquency. But this was in women who had chronic use and were using it recreationally. In addition, the most predominant area in the brain where the cannabinoid receptors are located are in the striatum, in the prefrontal cortex, the cerebellar area, white matter connections, and the medial temporal lobe. So prefrontal, the medial temporal lobe, so that subserves memory. Striatum is deep inside, so that subserves movement, and white matter connections and cerebellum. So this is where the cannabinoid receptors are found most predominantly. And in one study by Jaeger in 2010, it was found that cannabis can affect the frontal lobe, and there may be impact on working memory. However, this was studied in a population of adolescents and older children who were using it recreationally. So it's not clear to me if this can be correlated to developing brains using medical cannabis for medical purposes. Also, in addition, it was also found by Scott in 2016 that there is axonal migration and synaptic connections that may have been possibly impaired in adolescents and children in the use of chronic cannabis. But again, this study was done in children and young adolescents who were using it recreationally, not so much for medical purposes. So to summarize, in my review of the literature for ADHD and pediatric patients, it's not clear to me that there's enough evidence to support this, just because all the clinical studies at this rate has been in adult patients. And these were deliberate studies, randomized placebo-controlled clinical trials, and the studies were very small. However, it doesn't mean to say that it doesn't negate the possible benefits in the pediatric population. It just hasn't been studied. So that's still up in the air, and it's probably used widely anecdotally, and there's probably some physicians who probably get benefit from that, or they see benefit in their patients. So as of now, I can only see very limited trials in small populations in adults, and it's very difficult to come across clinical trials or large trials in pediatric patients. But as the popularity of medical marijuana occurs, this will probably be studied in the future. Now, regarding its effect on the developing pediatric brain, although there were studies that it does affect the fetus, it can cause hyperactivity, inattention, impulsivity. These are in mothers who used it recreationally, and it's unclear about the dosage, the components, if it's synthetic, if there are additives. So I'm sure there's effect on the fetus, but it's not well delineated as to what amount is necessary to cause these side effects in babies or in children who are born to patients using medical marijuana. So if, let's say, someone were being treated with medical marijuana and they accidentally got pregnant, then the effect would probably be much different, because it would probably be a much lower dose and in a different form and not smoked recreationally. So that correlation is not clear to me. And then regarding the effect on working memory, again, this was found in the impact on working memory was impaired. This was found in adolescents and children who had been using it recreationally. And it's not clear how much you can extrapolate from that data regarding pediatric patients who could be using medical marijuana for medical purposes. So from my review, there is benefit in adults, and there's a small, very small study. There's not enough trials to support this, but there is some evidence. In the pediatric patient, there's not enough clinical evidence. It doesn't mean it's not going to work. It's all probably going to be anecdotal case reports in the future at this point. And then regarding effect on the pediatric brain, there's a lot of neuroplasticity, so that is still murky. And the studies that have been shown to have impairment, it's in adolescents who chronically used it at a recreational basis, and it wasn't used for medical purposes. So that's a very different way of administration. All right, so this ends my my video on part 12 of medical marijuana and its impact on ADHD in the pediatric population. So there's some use in adults. It's very, very limited information, but there's some evidence. In pediatric patients, there's not enough scientific information out there. It can probably be used anecdotally, so that's at the physician's discretion. And then regarding the development of the brain, it's very difficult to extrapolate unless you study a pediatric population on medical dosage and follow them along. So at this point, there's no studies to show that it affects the developing brain, but it does show that there's impact on those who have used it recreationally and who have heavily used it in the adolescent age and in children. So those are my take-home points from reviewing the literature. Okay, so I hope that was helpful, and this is Dr. Thornley signing off.